It can be a very challenging situation for both patient and the doctor to be in. Adenomyosis can affect the implantation and the carrying and the maintaining of the pregnancy. And it can be the reason of the repeated negative tests so that the implantation is not happening. So it can be the cause of the recurrent implantation failure or the recurrent IVF failure, both. So adenomyosis is basically also can be very symptomatic, meaning the because the uterus is very congested and it can be seen in the ultrasound for real, that these patients might have a lower quality of life in this sense that the pain can be so bad that sometimes they can't go to work. Um, adenomyosis is basically the muscle of the uterus is having the glands, and these glands are active during periods, and that causes pain, and the congestion and the circulation of that area is higher. Obviously, the nature of the problem is it's an inflammatory basis of the pathology, so that is an independent cause of pain. So it can be very symptomatic. And the treatment is difficult because there is no capsule around adenomyosis, unlike the fibroid. Taking out the fibroid is relatively very easy as compared to correcting the adenomyosis. But I have seen, because of various reasons, maybe the operating surgeon is not trained enough or doesn't feel confident enough, but removing or not removing adenomyosis, first of all, this decision, and then if at all it is to be removed, who does that? These are two independent important things. So whether this adenomyosis is supposed to be left in body or it is supposed to be removed is the first decision, which is to be made very carefully. And then if it is to be done, it should be done in the right hands, can really do it properly without damaging the uterus. We do not have studies, but in the severe cases, removing the adenomyosis might give a better outcome. Another way how adenomyosis can be treated before the IVF is by giving the depot doses of, the depot lupride or depot prostap injections that we use, which basically calms down the whole reproductive organs. And in that process, it calms down the adenomyosis on the functional aspect also. So everything has one physical aspect of just the mere presence, and then the functional aspect, the biochemical aspect. So at least that aspect is taken care of by giving this depot injection, which is given once a month, sometimes 1 or 2 or up to 3 months before the actual IVF is done. This injection will calm down the whole reproductive system, and it improves the outcome in a rightly selected group of women. In cases of adenomyosis, I try to give the injection Prostap before, at least once before the IVF, and also before the frozen embryo transfer if we have the frozen embryos for this patient. So this overall anti-inflammatory effect of this injection might help, although it is not in the protocol for many units because the evidence is not enough yet. But these are the two methods, medical and the surgical, for adenomyosis. But it can be a massive challenge for the doctor as well as the patient, because if at all the adenomyosis is pretty significant and the previous implantations have failed, then removing the adenomyosis in safe hands might help. But this is an important and careful decision after proper discussion, with the discussion of the side effects or the complications involved, because we are actually taking out the adenomyosis and restitching the uterus, so it needs time to heal back. And it can be more traumatic in untrained hands because it doesn't have a clear capsule. So the expertise of the surgeon becomes very crucial.